Myself, Dr. JIBRAN, Ahmed presents to you Simply Pathology, and today we are back with a very important session. Now, today's topic of discussion is very important for all the exam going MD DNB pathology residents. Not only the exam going resident, this lecture is also going to be helpful for the second years as well as the first year residents. Okay. Now, unlike the previous lectures that I have taken, wherein I have discussed in details about each and every important topic from exam point of view, I have also discussed in details about the recent advances and the important topics regarding recent advances. So the links to those videos will be left in the description box. So if you have not seen those videos, please go and see those videos. Now this video is unlike the other videos. We are not interested to discuss the most important topics. Rather, what we are interested in today's topic of discussion is the pattern of examination. That how the examination is conducted. Okay, what is going on in the mind of the examiners. Okay, now this is very important because for the last few years I have been seeing that some of the good students, okay, they are not doing very well in the exams. Okay, and many of you, in spite of reading so many topics, you are not able to reproduce the result. So today we are going to see that where is it that you people are making mistake. Okay, because this is very important to understand that just reading so many things and reading everything together is not going to solve your issue. Okay, so if you have to successfully pass the MD DNB exams or secure gold medal, you have to think like the examiner. You have to think how the examiner is going to set the questions. So you have to be smart over there, and that is what we are going to do today. We are going to dissect the question papers. We are going to dissect the practicals, all the important topics, what the examiner is looking for, what are the important things that you should know. So we are going to the basics of those lectures. And this lecture is very important from that point of view. And I am going to show you that how a question paper is set. So what are the topics that you have to read and revise and concentrate on, rather than concentrating on so many topics together. So that is why this particular lecture is very important, because it is going to ensure that you pass your examination successfully in the first attempt. Okay. So without wasting any time, let us begin today's topic of discussion. So as we have already seen in the previous lecture that the MD DMD examinations, they are comprising a part of thesis which has to be submitted at least 6 months before. Then you have a theory paper that you have to pass separately, and you have to pass separately in all the papers. Then you have practical examinations. Okay, and then your to some extent, not to a very big extent, but to some extent, your passing is also related to your behavior, that how you behave, how is your personality. Okay, whether or not you are you are dealing everything professionally or personally, whether you have been rude with the teachers or you have you argued with anyone, because that goes on to a they go on a long time long way to deciding, but it is not a very big factor. So do not get worried. This is not a very big factor, but yes, it can play a factor in certain situation. Okay, and also luck also has a very small role. So it is having, most importantly, behavior and luck, they are important in the borderline cases. What is a borderline case? Borderline case where you are just falling short of 1 or 2 marks. In that situation, it is your behavior and some amount of luck that is going to help you pass. Okay, so this factor is also there. Now, among these two, theory and practical, you have to understand that among all these parameters, the most important parameter is theory. Theory is the toughest parameter out of each one of them. And trust me, last year, those who were unsuccessful, yes, in my institute, among all the residents, approximately 16 to 1700 residents had given exam last year, and around 5 to 6 people, they were unsuccessful. But this time they have given the supplementary exams and they have done marginally well. They have done excellent. They have done very good, and they have got good results, and everyone has cleared the paper. Okay, but if you ask them, all those who were unsuccessful, they were unsuccessful in theory, and in majority of the cases, okay, they failed because of 1 to 2 marks. This is what was there. They just failed because of 1 or 2 marks. They failed. So theory is very important, because if you are not able to make it, it will be because of theory. And why is it important, we will discuss today in details. Coming to the practicals, if you see that most of you will do very well if you have attended the residency diligently, your attendance is full, you have worked in the department, you have really gone through the rigorous training, and you have done your job honestly. So in that situation, practicals are going to be a cakewalk. You can ask your seniors as well, they will also tell you practical is a cakewalk. Everyone they do very good in practical. Rather, I will tell you, last year one of the students, they failed in the exams. That student has topped the practical. So among everyone, she topped the practical, yet she failed in theory because of 1 mark. So try to understand, theory is very important. And the biggest issue is that most of you do not start reading in the first year. You think that, okay, what we will do in the first year, this and that, okay, and you just first year is going because your seniors have told you that why you are reading in the first year, you have a lot of time, 3 years is there, so you also take it very lightly. And also there is no examinations and there is nothing in the first year, just you are doing some clerical work in the first year, so you completely waste that time. But that is the only time you will get to read your theory nicely. After that, there is no time. This is the fact. Okay. Anyone who has given the examination, go and ask your seniors who have given the examination, they will tell you. Okay. So what are the different components of the PG exam? I am not going to discuss about this because a separate video has already been made. Over here, I have just given a repetition just to give you an idea that for passing the theory, you require 50% marks. And as you know, there are 4 papers, paper 1, 2, 3 and 4. Okay. And you see that NMC has given a guideline, as in the paper number 1 should contain general path, molecular path. Paper 2 should have systemic path and cytopath. Paper 3 is having hematology, clinical pathology, blood banking, and paper 4 is dealing with recent advance. Okay. But this is a broad division, and not all the universities in this country, they follow NMC. Majority of them, many of them they follow, many of them they don't follow. Okay. So this division is variable. Okay. And also one thing, it is not like if the division has been made, so questions will only come from that particular division. Like for example, you might get a systemic pathology question in paper 1, you might get a recent advanced question in paper 1, and I will prove you this today with the help of certain examples of question paper. So please stay tuned till the end, because I will show you, I will give you examples of the question paper, and I will show you also that what is happening. Okay. So they can be intermixed, but predominantly they will have questions for that. Like for example, paper 1 will predominantly have general path. They might give you, for example, they might give you peptic ulcer disease in paper 1. So there can be. Similarly, in the recent advance, topics from paper 2 or paper 3 or even sometime paper 1 can be given in recent advance paper 4. So this is there. So this interchange of questions among different papers is there. Okay. So remember one thing. So something of everything, okay, you have to always remember. So this is the fact that whenever you are going for exams, you have to take this into consideration. Okay. So NMC have said that there should be 1 long answer question and there should be 6 to 8 short answer question. Many universities they follow this, many universities they have their own pattern. That is why it is very important that you please see your university's last 5 to 7 years question to see the pattern, because that is only going to get repeated in your exams. Okay. Now over here, practical examination is conducted, approximately 500 marks is there, and 100 marks out of them is for internal assessment, is conducted over a period of 2 days. Now I am not going into the details of each and every section. As we know, there is a section on histopathology including grossing autopsy, a section on cytopathology is there with histocytotechniques. Okay. Then there is hematology, clinical pathology, blood banking section in exam. Then lastly, you have the grand viva, thesis, basic sciences, etc. So all these things are there. I have discussed about this in detail, so I am not going over there. So without wasting any time, just I wanted to give you a revision of this part. Okay, this division I wanted to let you know. Okay. So now we are going to discuss the major part, that is dealing with the theory paper. Okay. So remember what we are going to discuss. Number 1, the distribution and the trend. So no one is following the NMC guideline, as I have already stated right now, कि no one follows NMC guideline. No one follows. Okay. No one follows the NMC guideline strictly. Some of them yes, but some of them no. So it is very important for your theory. You see your university's last 5 to 7 years question paper. Okay, last 5 to 7 years question paper is what you have to see for your university. This is very important. Okay. Second thing that is there is you see the question pattern. Okay, you see the question pattern. Now regarding the question pattern, it is very, very important to understand that sometimes there is a, there is a discussion, there is a standard paper. Okay, then there is a easy paper, then there is a difficult paper. So today I am going to let you understand this concept, that what is basically a standard paper, what is basically a easy paper, what is a tough paper. So a standard question paper is one where 70 to 80% of the questions, they are repeat as in they are very commonly asked questions. So if you look at those questions, you will not be surprised. That is the meaning of repeat questions. So if you see the last 5 to 7 year question paper, you will see they have taken from there, and these are very easy questions. Okay, and 20 to 30% of the questions, they will be a bit difficult, which once you see those questions, you will think, okay, this is a bit difficult, or they might be completely new. They might be completely new paper. Okay. Now, out of the 70 to 80% of the questions, which are the repeat questions, you will see that 50% of the common questions which are coming, they are based out of systemic disease based questions. Okay, I have given you a detailed list of these systemic disease questions in the video of 90-day revision. So if you have not seen that video, the link is in the description box. Please go and see. There is a list of certain 20 to 25 questions. Okay, if you read these questions, okay, at least 20 to 30% of the entire paper, or out of 100, 30 marks, 20 to 30 marks is guaranteed. So that part is constant. So what do you understand? That the system based question or systemic based questions like myocardial infarction, diabetes, atherosclerosis, this list of questions that I have already given you. Okay, from those set of questions, already 20 to 30% questions are going to come. So this 20 to 25 questions, if you are reading that, always revising that, so with your eyes closed, you can answer that also. So you do not have to take tension about that. So those 20-25 question, which is so easy and which is a standard question, which is always coming, which is a systemic question that I have the list of which I have always given you. So if you do that, already 20 to 30 marks is for you. Okay, this is number one thing that you have to understand. So among the repeat, those questions which are systemic based questions like diabetes, myocardial infarction, atherosclerosis, glomerulonephritis, alcoholic liver disease, all these are very common topics. So list of 25-30 questions are there. Just read those questions and you are done for 20 to 30% of the paper. So these questions should not be missed. If you are not able to write about diabetes, if you are not able to write about myocardial infarction, if you are not able to write about peptic ulcer disease, then it is a very, very bad situation for you. These are the questions, if you are not able to answer them properly in the exam, then you are going to lose marks and then you might fail. And this is where the issue is lying for a majority of students, where you don't realize that you are making a mistake. You have to read these questions very thoroughly, that no portion of these questions are mixed. Okay, you have to be very thorough with these questions, because for example, they might not ask you pathogenesis, they might ask you the complications of diabetes mellitus. And if you do not write them in details, you will not get good marks over there. And if you lose marks over here, then you might fail. That is the importance of these questions, which are sure short questions which will come in the exam. Okay. Now I am going to give you examples of standard questions. Okay, paper wise. So what is the example of a standard question paper? Let me give you over here. So as I told you, 70 to 80% is repeat. 20 to 30% questions, they are new or they are difficult questions. So if you see over here, embolism, fat embolism, if you see, direct question, 1. Primary immunodeficiency disorder, direct question. It is also, this is the paper 1. Okay, this is the paper 1. Okay, paper 1 is basically having general path as well as molecular path they are having. Then they are having role of tumor in tumor growth and progression, role of stroma, the EMT, neoplasia chapter, direct is there. Then you are having over here role of autopsy and the diagnosis of sepsis and related fetal syndrome. If you see the recent advanced 23-24, it is a direct question from one chapter. Okay, this is a direct question from one chapter, the notes of which are also available in the application. Okay, so this is a direct question, but what is the problem? Recent advance is paper 4, but it has come in the paper number 1, right? So as I told you, there is always mix and match that is there. Okay, then you have another direct question, lab diagnosis of genetic disorder. These are all covered in my notes, 100% covered in my notes. Then there is one question, role of histopathology in cutaneous fungal infection. Now, if they have asked you just fungal infections, you can write certain fungal infections. But if they are asking you, specifically cutaneous fungal infections, you have to sit down and you have to think about that. Yes. So if you have to think about those questions, that means this is the bouncer, right? So basically one question is the bouncer over here. Next question, if we see antibody mediated graft rejection, again this is the question from recent advance. It is a direct question from RA 23-24, but it is paper 4 is asked in paper 1. But even after that, okay, this part is also taught in case of the general path. Okay, this is also there in Robbins general path. So it can be either direct question or this also. Then prostaglandins and inflammation and cancer is there. So that is again a direct question. Quality management in histopathology lab. Now this is a paper 2 question first of all, and this is again a bit difficult, though I have already covered this question, but this is not a very direct question and not everyone is going to read this question for the exam. And then we have Epstein-Barr virus and cancer, which is again directly from chapter number 7, which is covered. So if you see over here 1, 2, 3, 4, okay, 5, 6, 7. So approximately, okay, if we also include this recent advance, if you see approximately 70 to 80% of the questions, they are direct. Okay, 7 questions from general pathology and 1 question from RA. If we take 70 to 80% questions, they are standard. The only question which are a bit difficult is this question, okay, this question which is the bouncer question, and if you have not read the recent advance and if you don't reproduce, then these questions also become difficult, right? So if you are able, so this is a standard, really this is a standard question. So this is how a standard paper is. Why am I calling it standard? Because almost all the chapters are covered over here, okay. Equal distribution of topics is there and there is practical applicability is there. So this is a very, very practical question paper and this is from one of the very famous, universities in South India, okay. So this is one set of questions that I am showing you, one example of standard question. Another question we will see, this is a paper number 3. Paper number 3, now let us see how a standard question paper is there. Paper number 3 usually has hematology, usually has blood banking and cytology as well as clinical pathology. Sometimes cytology is there in paper number 2. So let us see, the first question is pathogenesis and diagnosis of HLH syndrome. This is a direct question. Multiple myeloma, recent concepts and risk stratification, again a direct question. Approach to the diagnosis of hemophilia, again it is a direct question. Or approach to the diagnosis of bleeding disorder, that we have already read about that. So this is a part of that question that they have asked. APML, acute promyelocytic leukemia, again this is a very direct question. Now I will come to, this is a red cell enzymopathy. Now this is a direct question too, okay, but it is having a twisted name. What is this? This is G6PD deficiency, pyruvate kinase deficiency. So they are talking about red cell enzymopathy. This is a hemolytic anemia. Now the next question, although it is seeming to be very easy, but it is very difficult. It is a recent advanced question. Iron refractory iron deficiency anemia. It is not iron deficiency, the iron refractory iron deficiency anemia. Now you see quality control measures in hematology lab, direct question. Therapeutic preparation of platelet, direct question. Like this is from the blood component. Blood transfusion reaction, direct question. Molecular diagnosis of beta thalassemia, direct question. Now if you see over here, they have just asked and concentrated on hematology. They have not, they have given questions, some questions are there from blood banking part 2, few questions are there. And clinical pathology, I don't think any much questions is there from clinical pathology part. Yes, there is there, quality control is there. So yes, clinical pathology is there. So over here, cytology wasn't there. So maybe cytology is asked in the second paper. So basically what I want to say, this is a standard and this is, easier than the standard paper. So 80% direct questions are there as you see. Only 2 questions are there, which is a bit twisted. One of them is not a difficult one, but if you do not know the enzymopathies, and you might miss this question. And this, the question number 6, these 2 questions, if you see, these 2 are a bit difficult and one of them is a complete bouncer. You do not have an idea about iron refractory. So So what I would have done is, I would have not left this question. In the end, I would have attempted this question, and what I would have done, I would have just answered iron deficiency anemia only. Maybe the examiner gave me out of 10 4 marks, but that 4 marks would be very important for me. If I don't write anything, maybe I will not get any marks. But if I write some things, if I write the whole of iron deficiency anemia, at least I can get 4 marks out of 10. Okay. Okay, so this paper, if you see, again 80% paper was direct question, and it was covering all parts, hematology, blood banking, and some part of clinical pathology was also there. Each and every of this question is there in the application. Again, this is a very easy paper. Now again, another example of your standard paper is paper number 4 I am taking. So let us see what is the recent advanced questions that they are asking. So HPV detection techniques in cervical cancer. It's a direct question from recent advance, RA 2324. If you see, a direct question. Ancillary techniques in urinary cytology. Now this is also an easy, but it is a bit difficult. Not everyone will read about this question. Okay, so this is not very direct question. Then we have application of artificial intelligence in diagnostic pathology. It's a very direct question, commonly asked. Fish and its application, direct question. Okay. Now biomarkers in GI cancer, again this is a bouncer. It is not that it is because it is not that it is very easy to answer this question. Although we can write few points here and there, but to elaborate on it is difficult. Recent advances in the pathogenesis of rheumatoid arthritis. Now this is again a bit difficult, okay, to remember, because there are so many systemic disorders. Recent advances in osteoarthritis can be there, rheumatoid arthritis can be there, atherosclerosis can be there, MI can be there. Any and every systemic disorders can have your recent advance. So what I would have done personally, if I was giving exam, I don't know the recent advance, at least I would have written the pathogenesis of rheumatoid arthritis. That I know by heart from Robbins. So that I would have answered, at least I would have got 5 out of 10. Okay. Then we have the molecular classification of breast carcinoma, very easy and direct question. Okay, recent update in neuroendocrine, again very easy direct question. IHC of carcinoma of unknown primary, direct easy question. I have already completed all of them long time back. Cell concentration techniques in effusion, again in effusion cytology it has been discussed in details, very easy direct question. So if you see over here 1, 2, 3, 4, 5, 6, 7. 70% of the questions in paper 4 is very easy. Okay, and rest of the question, if you see, this is the complete bouncer over here. Okay, ancillary techniques in urinary cytology, again is a big bouncer over here. Okay, and this recent advance in pathogenesis of rheumatoid arthritis, again this is a bit difficult. So if you see 3 questions in any paper, 2 to 3 questions are a bit difficult or new or something like that, but rest of the questions are repeat questions. Now what I want you people to understand from this point is that what you people do, suppose they have given biomarkers in upper GI cancer, okay, they have given, for example, ancillary techniques in urinary cytology. Usually these questions are not asked, and there is a very slim chance that these questions will be repeated also. But all these other questions that are common questions or these are repeat questions, they will keep on juggling. Now if you also see over here, molecular classification of breast cancer, usually paper number 2, okay, or paper number 1 question. Again neuroendocrine tumor, again this is paper number 2, but it is again recent advance. Okay, so again I cannot say that it is completely a paper like HPV detection, cervical carcinoma, again it can be asked in both paper number 2 and paper number 4. Okay, again this question, cell concentration techniques in effusion cytology, this is a cytology question, not in total a part of your paper number 4. So there can be a mix of everything. This is what my message to is. So mix of questions from different paper can be there, right? But what is very important for you people to understand, that such questions which are a bit bouncer, at least this particular question, okay, such questions which are bouncer, they might not be repeated. So don't waste your time and energy finding answers to those questions which are at all never repeated. So if they are not repeated, don't waste your time and energy on such topics. Because suppose if you are reading 5 to 7 years last year question paper, okay, so over here if there are 70 questions, okay, 70 questions that you have to read, just I am saying, so out of these 70 questions, if all of them they are standard paper, so in any one paper there is 2 to 3 questions which are odd. That means in 7 papers, if you see, out of this 70, 14 to 15 questions will be such that are completely new, they are not repeated because the examiners, they have to form a standard paper in this manner. They cannot give you every question which is very easy. They have to give you few 7 to 8 questions will be easy, 2 to 3 questions will always be difficult. So there is no point, wasting time and energy on something like this, that maybe this will come, and you are wasting your time and energy. It is much better that you revise those 20-30 questions which are from systemic disorders like diabetes, SLE, AIDS, myocardial infarction, all these basic important direct questions which are coming. You should give more time and energy to those particular questions. Okay, this is what my thing is. So if you see, approximately this 70 questions that is there, that is from the last 5 to 7 years. This is for one paper. If there are 4 papers, if you multiply into 4, there will be basically 280 questions is there. And if you see for all the papers, if you just multiply with it, then basically 15 into 4, basically 60 questions, approximately 60 questions are there which are new and which will never be repeated. So my point is that you concentrate on those questions which are repeated. Don't waste a lot of time and energy revising these questions. Maybe in the next paper that you gave, out of this 280 questions, maybe 70 to 80% questions are repeated. But out of the 60 questions which was from the new questions, maybe only 5% is repeated. So is it worth wasting so much of time and energy on the on the new questions or odd questions whose likelihood of coming is very slim, right? So this is my point, first thing. So what is the key point that we have taken? That in a standard paper, 70 to 80% of the questions, they are repeat questions. 20 to 30% is new. So first you will see the last 5 to 7 year question paper repeat questions. Out of those 70 to 80% repeat questions, as I told you over here, 50% of the repeat questions are from the systemic disease based questions, the list of which I have already given in the 90-day video session. So this is one important takeaway, take home message. Second message is that, as I have already explained to you, that it is not that paper topics of paper 1 will be confined to paper 1. They can be asked across any and everywhere, as I have given you examples over here. So if you read properly, if you read nicely, there is nothing which can stop you from passing. Okay, and if you do very good revisions, okay, then you are definitely going to pass with very flying colors. As you can see, the paper is not very tough. So this is about the standard paper, and 90% there is a chance, okay, that you will get standard paper only. Okay, so there is a 90% chance you will have standard paper. Now there is a second type of paper that is there, which is very easy question paper. So the chances of getting a very easy question paper is approximately 5%. You have chances of getting a very easy question paper. Let us see this particular question paper. This is the paper number 2. So discuss the pathophysiology, morphology, lab diagnosis, complications of MI. I told you these questions of MI, they will always come. Okay, then you will see there is one more question on diabetes mellitus. So these systemic based questions, these are always asked, commonly asked, repeat questions. So over here 20, if you see, not even 20, over here 20 marks of MI and 10 marks of diabetes. So out of 100, 30 marks, okay, is already from those set of 25 to 30 questions that I have already given you in the previous lecture. Okay, the list of important systemic based questions that I have given you the list. So 20-30 marks, they are for you, they have given you because they want to pass you. Then one more question, you see the direct question is the germ cell tumors of ovarian tumors. Okay, the germ cell ovarian tumors. Then the Bethesda system of reporting of the thyroid. I have constantly mentioned in cytology, reporting protocols I have completely given. Okay, the latest reporting protocols I have given in my videos. They are the scoring. Now you see in this one question paper, one reporting of thyroid they have asked, another reporting they have asked for cervical cytology. So 20 marks directly is given to the reporting, direct. So think how much you can score. Then you have direct questions like leprosy, glioblastoma. Okay, then you have comment on lymphocytic infiltration of tumor. This is the only question which is a bit difficult. Okay, this is the recent advanced question actually. Then histology, differential diagnosis, giant cell tumor of the bone, endometrial stromal tumor, bulbous disease of the skin. All of these are direct questions. So 90% of the questions that is asked over here, they are easy questions, they are repeat questions. So you can score a lot of marks in this particular question paper. And this is also a very good question paper because they have given such a nice mix of everything. Okay. Now comes the paper number 2. Again, this is another university. Paper number 2, again I have taken. Again, you see they have asked you diabetes mellitus. It is an age-old repeat question. Diabetes, atherosclerosis, myocardial infarction, peptic ulcer disease, glomerulonephritis, SLE, AIDS, amyloidosis. All these are commonly asked questions. Viral hepatitis, all these are commonly asked questions. So 2 to 3 questions from there will come. 20 to 30% is given to you just freely to pass. So if these topics are not covered by you, then it will become difficult for you. Then the next question is lung adenocarcinoma. The role of IHC in differential diagnosis is a very easy question. Okay, between lung adenocarcinoma and mesothelioma, 1000 times it has been discussed. Direct question. Lupus nephritis. Okay, very commonly asked question. AIDS, CNS lesion of AIDS. Okay, subepidermal bullous lesion of the skin. Very common direct question. Again, see in one paper you see again diabetes mellitus is asked. Myocardial infarction is asked, SLE lupus nephritis is also asked, AIDS is also asked. So 4 questions, 40 marks has been given to you. Okay, this is from those list of 25 to 30 questions which I already mentioned, systemic based question. Pathology of gestational trophoblastic disease, HNPCC, and risk assessment of breast carcinoma. These are so easy questions, so direct questions, 90% math, 90% easily, very, very straightforward, easy questions have been asked over here. So I am just saying this is a very easy paper. Okay. So 90% of paper will be standard as I told you. 5% paper can be very easy as I have given you. But in case of 5% of the papers, 5% of the papers can be extremely difficult. Now this is a set of question paper, okay, for 2025, a very famous university in the western part of our country. In the western part of our country, I am going to share you all 3 papers. I will show you paper 4, paper 3, paper number 1 I will share you, and I am going to make you understand how much it was difficult for the students. This was the toughest paper. Okay, this group of paper, they were the toughest paper, and you will not believe that out of what was the pass percentage this year for that university? The pass percentage was only 40 to 45%. So suppose if in this university, okay, approximately if 100 people had given exams, around 60 to 65 people or approximately 55 to 60 people, they have failed. So the pass percentage of that university was only 40 to 45%. I know everyone, I am talking about which university. So you can write down in the comment section which university I am talking about. Okay, so let us look at the paper number 4 that they have given over here. So, okay, this is, sorry, I am very sorry, I have made a mistake. Okay, these are the bit difficult paper, and this that I was talking about mainly the very difficult paper. Okay, and I will discuss about the very difficult paper, this set of questions, the difficult paper. Okay, so the paper number 3, just see the questions, the hematology section. What are myeloproliferative disorders? Describe BCR-ABL negative myeloproliferative disorder. Again, this is a direct question, though a bit twisted, direct question. I will take it. Second is, what are the various blood group systems that is there? Easy question. Describe the 3 most antigenic blood group system. Again, this is also easy. But the next question, describe the methods used in blood centers to optimize the utilization of Rh negative blood units. So over here, for example, 20 marks was direct. Over here, only 10 marks or maybe 12 marks over here, they are direct. Rest question is not very easy to answer. Normally a person cannot answer this question. Next question, what are Westgard rules? Now this is from your principles of lab science, quality control inside of hematology lab, the LJ chart, and what is the Westgard rules. I have discussed in detail. So although this question has been covered by us, but again this is not a very easy question to answer. How will you use them? Okay, till here also you can answer. But the question is, how are you going to calculate the MU and what are its advantages? This becomes the difficult part. Again, over here, only 10 to 12 marks. Even some of them, they must not have heard about what Westgard rules are. If they have read, they might have not remembered, because this is very difficult to remember. Okay, look at the next question. Write in details about the indication, methods, reporting format, interpretation of semen analysis. Again, not a very direct question. Again, the first part of that is all right. 10 marks is all right. What are the methods of automated semen analysis and their advantages? So again, 10 mark is direct, rest 10 mark is difficult. Lastly, if you see what is chemiluminescence, what are its uses in pathology, compare its advantages and disadvantages versus ELISA. Now, this question is completely a question of biochemistry. Now, before you ask this question, there are 1,000 different questions which you could have asked. What is PCR? What is Sanger sequencing? What is next generation sequencing? What is FISH? What is comparative genomic hybridization? What is karyotyping? Okay, there were so many easy, or there were so many molecular questions that they could have asked you. Yes or no? But instead of these commonly, or they could have asked you flow cytometry. Instead of asking this question, they asked completely somewhere. So this question completely became a bouncer, because no one in the right minds will read about them before the exam. So 20, 30, 40, 50. So only 50% of the questions is something that you know, and even this 50% that came, these are not very easy questions. These are difficult to remember. These are not the first line of questioning. So this is a difficult question. So over here, it becomes very difficult for you to pass. Moreover, if you see, one of the worst parts of this kind of questioning is that instead of giving 10 marks, instead of giving you a large choice of questions, you have got a very limited questioning from very selected topics. So in the recent advance, they have asked you one question from hematology. This they have asked you from blood banking. Okay. This they have asked you from clinical pathology. Okay. Then this they have again asked you from clinical pathology. And this again, it is basically a laboratory science, a clinical pathology question. But I cannot see any relation with the recent advanced question. We are having the recent advanced 23, 24, 25, 26 and now 27 has also come. We are having recent advances in hemat 1, 2, 3, 4. They have not asked any line of question regarding the recent advances, if you ask me personally. So this puts the students in a very, very difficult spot. And in 5% case, you might get this type of question. So such kind of question paper, which I believe that was made this year because they wanted to take some kind of revenge from the students, I cannot understand at all. If they have taught each and every question and if they have taken lecture for these questions in your university, if they have taught you these questions, then they have asked you these questions, it is no problem. But if you have not taught these questions and if you are asking these questions, such difficult questions if you are asking, then this is not done. And I cannot understand that how such a famous university has done this. Okay, so this was the paper number, this was the paper number 3 only. I'm very sorry. This was the paper number 3 only. Okay, not the paper, this was the paper 3. Now coming to the paper number 4, if you see, if you look at the paper number 4 and look at what they have done over here in the paper number 4. So in the recent advance, their first question is homologous recombinant deficiency, how it is evaluated and what is its utility. This is a molecular question. Okay, I agree. This is a question in relation to the DS double stranded DNA break repair, and this is basically there in chapter number 1 of Robbins plus chapter number 7 of Robbins. Some part of that is given here. But how it is evaluated? Again, 10 marks is more or less direct, plus again 10 marks of the question is difficult to answer. Second is, what is CRISPR-Cas9 technology? This is basically from gene therapy. Okay, this is a good question. RA26 for last year. Okay, they have covered this in details. So I have also covered them. This is a direct question. So 20 marks over here direct. Okay, no problem. The next question is, what is ISO 15189-2022 document and how is it different from? So this is basically mainly, relation to the NABL. Okay, accreditation of the laboratories. Some guidelines are there, right? And it is not a something which is very easy to remember. The booklet is so much big. And it is not the first time, this is the first time I have seen such questions have come. And we have also introduced a very easy, I have shared a PDF and booklet regarding this in the third year exam group. So, but those who have appeared for those exams, this was a complete bouncer for them. So this was very difficult. The next question is, so leave this question. Current technologies and future direction of AI. Okay, artificial intelligence, again it is important. And it was a recent advanced question. It is also included in RA 27 and now covered in the application. So it is a 20 mark question, but artificial intelligence is coming. It is not a very big deal. So 20 mark over here is direct question. 20 mark is there. Describe the role of histopathologist in guiding treatment in various forms of targeted therapy. This is again a recent advanced question. And again, targeted therapy is also important. So if you see over here, around 50 to 60% of the questions, okay, they are direct or repeat. Okay, whereas many questions over here, they are a bit difficult. They are not the first. So if you can understand, there is no direct question which is getting asked. And even the direct question which is asked, it is of a little bit higher standard. It is not very easy to answer these questions. So in the recent advanced question, again around, I can say 60 to 70 maximum, okay, could be answered from this paper number 4. But again, they have not given directly from the RA 23, 24, 25, 26 direct questions or something easier they have not given. Okay, so it is a bit difficult. Now the paper number 1, again we will see the role of epigenetics and disease progression. This is in chapter number 1 and chapter number 7 of Robbins. The role of stem cells and tissue repair and regenerative medicine. Again, this is from chapter number 1. Okay, the role of stem cells. Mechanisms of drug-induced organ injury with example. This is a bit difficult. It is covered in the chapter of liver. If you see, drug-induced injury is there. So they have given. So this is there, but this is there in paper number 2. Describe the cellular and molecular basis of chronic inflammation. Okay, this is from chapter number 3 that they have covered. Not a problem. And again, they have given tumor microenvironment interaction and role in tumor progression. The role of estroma. Okay, in short. Again, this is direct question. So if you see over here, the paper distribution is very bad. They have given nearly 40 marks has been asked from chapter 1. Okay. And if you see chapter number 7, again over here 20 marks again is from chapter number 7 directly. And basically they have asked you certain question from chapter number 3. So chapter number 2, chapter number 4, chapter number 5, chapter number 6 completely bypassed. So you have asked questions from only chapter number 1, chapter number 3, chapter number 7. So out of the 7 chapters, only these 3 chapters were considered for the questioning. So what I want to say is that there is a very poor distribution in this particular paper. If you see, very bad. So that should not be there. This becomes a little bit difficult. And all these questions that I am discussing, this is not for, for different time. This is the same university and same paper in 2025 January. The paper was conducted this year, 2025. So these were faced, all these 4 papers were faced by a single batch of people. So think how much it was difficult for them. Again over here, see, this is the paper number 2. So enumerate the Bethesda system of reporting. Over here they have not even mentioned Bethesda for what? Bethesda can be there for thyroid, Bethesda can be there for cervix. So over here, as I can understand, molecular method and everything, so this is for cervical cytology that I understand. Okay. So basically this is the Bethesda system for that. Easy question, direct question is there. Current WHO CNS tumor is there. Diagnostic approach for using IHC and molecular method for implementing it in most cost effective way. So the second part is again tricky. So 10 marks is alright. Over here 20 mark was alright, but 10 marks is difficult over here. Hodgkin's lymphoma, various subtypes, IHC for them, role of infective, that is the EBV they are asking. Okay. So again, this is also direct question. Polyps of GIT, precancerous, and this is also direct question. Renal biopsy again is a direct question. It's not very easy. So over here, if you see approximately, if you see 80 to 90% match was there. So out of the paper number 1, 2, 3 and 4, if you see, paper number 2 was easy. Whereas the rest of them, they were not difficult. Over here, paper 1 distribution was very poor. Paper 4 was very difficult, although most of the topics are covered in the application, but 1 or 2 difficult question is all right, but all questions, if it becomes difficult, it becomes very difficult for the exam, for the students. So this is the definition of a hard paper, of a difficult paper. Okay. So this is a difficult paper that I am talking about, and there is a 5% chance that you might land up getting a difficult paper in the exam. And if at all you get a difficult paper, you might get out of 4 papers, one of the papers you might get difficult. But seldom it happens that you know that all the 4 papers or all 3 papers or 2 or 3 papers they are difficult. It doesn't happen like that. So paper number 4 really was very difficult for this university. Now we are going to see a bit difficult papers which might happen, like this is an example of paper number 4. Electron microscopy. All the electron microscopy, light microscope, they are important questions for exam, but not the first choice. The second is the role of EM in glomerulonephritis. This part is easy, but the first part was a bit difficult. Okay. Second, GVHD direct question easy. Diagnostic role of needle aspiration cytology of salivary gland. Again, this is very easy. We have discussed this 2-3 years back only. MRD in hematologic malignancy, direct question, easy question. Digital pathology, again it is a bit difficult, but again a direct question from Pranab. I have always said about this: artificial intelligence, whole slide imaging, digital pathology, all these 3 are important questions. Okay. Recent updates in the classification of CNS tumors, okay, which is again a direct question. Application of endomyocardial biopsies are there. Okay, this is again a time old question again, but it's a bit difficult, but it is covered. It is not something which, it is not a repeat question. ECAS, it comes under the automation in the, not automation, it comes under the quality control of hematology lab. You have the ECAS system. So again a common question. SISH, again SISH is not very, not a question which is not, which is very uncommon, but again it's a bit difficult. So if you see over here, if you see direct questions, if you see 1, 2, 3, 4, 5, 6 questions, if you see 60% pure direct question is there. 10% question like SISH that is there, it is very difficult to answer. But 30% question, that is this question like endomyocardial biopsy, if you see, digital pathology, if you see, and even if you see this first part of electron microscope, this 30% questions, if you see, 30% of this question, if you see, they are plus minus direct. It is not that you may or you may not have read that, because during exams you have to read a lot of questions. So if you have answered most of these questions, then the paper becomes standard or easy for you. But if you are unable to write these questions, then it becomes a bit difficult. So this is the definition of a bit difficult. So right now I hope you have understood in details, okay, how the question papers are being set by the examiner. The standard paper comes in 90% of the cases. Difficult paper I have shown you, bit difficult paper I have shown you, and very easy paper I have also shown you. So remember, in 90% of the cases you will get a standard paper, whereas 10% cases will comprise a bit difficult paper, very easy paper. All these 3 will come under this 10% category. So you please concentrate on the standard paper. So what are the lessons learned? That you concentrate on the 70 to 80% of the repeat or the common questions from a pool of 300 questions that I have already formed, given you in the list. Don't run after the new questions, because the new questions, they are from a bank. The remaining 20 to 30% of the difficult or new questions, they are from a pool of more than 1500 to 2000 questions. It is not feasible to remember. Okay, you will lose time, you will lose energy, and nothing will come from those parts. So the basic approach, as I told you previously, last 5 to 7 years question paper has to be done, followed by list of questions given by your given by us in Simply Pathology, and then that should be followed by more important more newer questions, or you want to read some more important topics you want to see. So that is a different game. So this is how you have to approach. Okay. The third important aspect with relation. Now the major part is complete. The question paper pattern was the most important that I have already discussed with you. So over here, one of the most important things that you have to understand is revision. There is no alternative. And first year is the only time where you can start reading questions, because if you start reading in the first year, then by the second and third year you will start revising them. But if you start reading in the third year, then God knows when you will start revising. And minimum of 3 to 4 revisions are needed, else it is difficult to remember. So the most important thing is start early, take actions, and stop procrastinating. Time management is very important. If you do not manage your time, you may land up losing up to 30 marks, and this year it has happened. A very good student, she was a very good student, she has not failed, she has done she has passed her exams, but not with a very good marks. But the student was very nice, and she was, she used to answer very well and she knew each and everything. But in the end, she did not manage a time, and 3 questions in general path, 2 questions in systemic path was very easy question, very easy question, and she had left those questions in the exam because her time management was bad. So how do you do the time management? First of all, you analyze and read the question paper very carefully. If they have asked you about MI, don't overread it as atherosclerosis and don't go and write about atherosclerosis in the exam. Answer to the point. They have asked you about the complications of diabetes, write complication. They have asked you about the pathogenesis, write pathogenesis. They have asked you only classification of diabetes, just write the classification. Don't try to write each and everything. Okay? You have to remember the headings. Whatever you read, you have to reproduce the headings, because examiner doesn't have the time and energy to read each and everything what you have written, but they go through the headings. And very importantly, you have to practice the art of writing. What you people are doing, 3 years, no one cares about you. You do not care about yourself. No one is making you write anything. You are not having any exams, no practice. The only practice you are having, just on the day of exams, you are having the writing practice. So how do you manage the paper? I will tell you. Suppose there are 10 questions. Each question is of 10 marks. Okay. And you have 3 hours of time. That means you are having 180 minutes. So you divide 180 divide by 10. So for per question, you are having 18 minutes. Now, some questions are very easy and some questions are a bit difficult. So for the easy question, you try to finish in 10 to 12 minutes. So in this way, what is going to happen? That for the difficult questions, you can allot 20 to 25 minutes. Okay. Or for the very lengthy questions, you can allot this. So you have to divide your time like this. And very importantly, I will now show you one of the most important ways of answering a question. And please mind it. It is not like I have all these ideas today or I am sharing with you all these ideas today. No. I had these ideas when I was in my residency. When I was giving my exam, I had these ideas. And I am just reproducing those ideas to you because I was under the impression that most of you have an idea about these things. But when I got the feedback from the residents about the problems and what their issues were, so I thought that it is necessary for me to make a video with this regard. Now you look at this paper very nicely. Suppose this is the paper that you have got. This is the paper number 2, for example. Okay, this is the paper number 2. Now I have seen all these questions. Now how am I going to answer? Now remember, always in the exams, as per my condition in my university, there was a provision that suppose you can write answer in any manner. Like for example, you can start off with question number 9, then you went to question number 4. Only thing you have to write that you are answering for which question, whether it is for question number 9 or question number 2 or question number this. Many universities, they ask you to answer the questions in that 1, 2, 3, 4, 5 format only. So in that case, you can leave the pages and then you can write the answer in the subsequent pages. Or sometimes they are giving only 4 pages or 5 pages for an answer and it is already printed. Answer number 1, this much part is there, you can write only in this much paper. Okay. So suppose if I am looking at this question paper and if I see, so how am I going to answer this question paper? Let me tell you. So I have got this paper. So if I am writing this paper, what I see, the first question that I am going to attempt is NAFLD, non-alcoholic fatty liver disease. Why? Because this is very easy and this is the shortest question. So the number 1 question that I am going to answer is NAFLD. Then I am going to see what are the other questions which are short, easy, and I know it. Prognostic, diagnostic markers of breast carcinoma, age-old repeat question. This will be my question number 2. This is what I am going to answer. Then I am going to go, which is the next shortest and easiest question. Paper number 3, question number 2, that is cystic disease of the kidney, will be my 3rd question that I am going to answer. Then I am going to see, okay, I also know this Gleason's grading of prostatic carcinoma. This is again very easy. Let me finish it very fast. I will cover the prostatic carcinoma Gleason's grading. Okay, then the question number 5, I will see myocardial infarction is there. This is again a scoring question, a bit long but scoring. I will do this question. So by this time, maybe in around 1 hour, I am able to complete most of these questions 1 to 5 that I am telling you. Okay, first question is NAFLD, second question is breast, Third is this. So how am I going forward? The questions which I know thoroughly and the questions which are short. So why am I doing this? So suppose in first 1 hour 10 minutes, if I have solved 50% of the paper, then I get a lot of confidence. Okay, and then the difficult questions I can answer in the end. Okay, the difficult questions I'm having sometimes, so I will answer in the end. Nothing to worry about that. At least 50% of the paper is done nicely. Then I will go to question number 6, inflammatory bowel disease. These are bit longer questions, so I will do it in the end. 7th question, discuss pancreatitis in detail. Again, over here they have asked each and everything about pancreatitis, so it is again lengthy paper. Okay, lengthy question. Question number 7 will be this. Question number 8, discuss about the pathology of ILD. Now ILD is not that much difficult, but still maybe you have to think about that, because there are many different entities under the interstitial lung disease part. So you might have to think a bit, though it is an easy question, but I have personally kept it in question number 8. Okay. Then question number 9 that I am going to answer, write a short note on endometrial carcinoma and the current concept. So this is the RA question. I have already covered this under the recent advances, under the FGT updates part. I have covered this. So this will be this. I have to think. It is not difficult, but little bit I have to think. So I will answer this. This will be my ninth question. And lastly, the role of chorionic villi biopsy. Now I have not read about CVP, in toto as a whole, but I know something about them from different topics. So I have to discuss. So I have to think about them. So what I will make sure that the last 30 minutes that I have, I finish all the questions, and I spend the last 30 minutes over here. Okay. So I will answer from here. So this is how I am going to approach a particular question paper. You start off with those questions which are easier to answer and which are also short. Then you go towards those questions which are easier to answer and which are taking more time. And then those questions which you have not read, or you have read but you have forgotten, you will take some time to think. Okay. So this is how you have to salvage the question paper. The art of triage or salvage is this. Please remember this. You will never go wrong with this particular way of answering the questions. Next thing in theory that you have to keep in mind, you have to carry a watch, take your admit card, check everything one day before the exam. You should relax and have a good day's sleep, because if you do not have a proper sleep, you will have problem in recalling. You will have headache. So the paper naturally will become bad. You might miss on a lot of things. Don't analyze. Now suppose you have given your paper, do not analyze the paper in between your theory exam. Like suppose you have given paper 1. Now when you come out, then don't discuss the paper, because there might be something you have done wrong. So now it doesn't matter. Now you have to give paper number 2, 3 and 4 accordingly. So if you discuss the paper, you might do something wrong, then you will feel bad and you might get depressed, and your further preparation might be hampered or impacted. Now majority of the universities, remember, they have similar mindset. So they are following NMC and they are following the concept of the standard examination or standard paper, like WBHS, Bihar, Assam, MUHS, RGUHS, AIMS, PGI, Jammu Kashmir, okay, VMMC, all these universities, they are having, Delhi University, DU University, they are all having a standard question paper mostly, but few are not following NMC. And so that is why the most important thing is that you have to follow your university respectively. So that is why it's important you see your question paper, your exam paper, because right now you saw so many different question papers, so many different patterns are there. Now remember, why am I saying that theory is very difficult to pass? Because the marking in theory is documented. So whatever marking it is given, which examiner has checked, name of the examiner. Okay. Now there is a box for each question. There is a box. It is divided. So suppose a particular question 10 marks has 3 parts. So 5 marks for one, 3 parts for another, 2 parts for one other part. So suppose if I have answered them and I have answered them nicely, or some part I have completely missed. So the examiner has to completely grade you on this 5 marks. So he has given you 3. Out of this 3 he has given you 2. Out of this 2 he has given you 1. So total he has given 6 out of 10. So there is no room that the examiner by himself can increase your marks, because he is answerable for each and every sub part of the question. So tomorrow, for example, I am saying tomorrow, for example, our examiner has given very good marks to a person in one paper. Another paper of that person was checked by another examiner, and that examiner has given marks according to the guideline. So one person has given, for example, out of 100, a person has got 70 marks. and another examiner has failed and given that person 48 marks, and this particular person, this particular resident, suppose he has gone for a recheck of all the papers. So when it was rechecked, it was seen that this person has given unnecessarily more marks. So who will suffer? Who is going to suffer? That particular examiner is going to suffer. So that is why in theory, every examiner is afraid to give marks, because they don't want to take any risk with this, because everything is documented. So in theory, you are on your own, and most of the residents who are unsuccessful, they fail in theory mainly. So theory, you have to strengthen your theory again and again. Revision is the key to that. And with this, we have completed the major part of this. I know this is a bit taxing. I'm taking a lot of time and stress, but this is very important for you. And I know that till now you have got a lot of insight into what you are going to do, or what you people are doing right now, okay, or what you should do in the theory. Now regarding the practicals, dealing with the practicals, already I have discussed in details all the important topics. Just I am going to go through some of the important points that you should keep in mind. A large part of the practicals is already covered when you are reading the theory, okay. And remember, practicals are far easier to score, because over there such documentation is not there, okay. No, means whatever you are answering to the teacher, they are not recording it. So okay, the examiner might give you some more marks in practical. So usually people score very good in practicals. So practicals, the most important generalized points that you should think about is, all depends on what you did in the last 3 years, how you have read in the last 3 years, what you have done in the last 3 years. It will take only 5 minutes for an examiner to judge you. The examiner can judge you in 5 to 10 minutes only. He can judge you whether you have worked honestly, whether you know, whether your basics are strong or no. He will know. Just few questions he is going to ask you, and he will understand. So there is no point lying to the examiner or trying to portray as if you are someone else and you have a lot of knowledge. No, don't do that. There is some room for giving marks in practicals, as I have already explained, and you should be able to converse clearly. You should be able to independently, you should be able to converse in the examination, okay. And what is very important, sometimes I have seen the residents, they are answering but it is not making any sense, any meaning. So whatever you speak slowly and you give a clear explanation to the examiner. And if you don't know something, say to the examiner, I don't know. Don't waste the examiner's time and don't irritate the examiner, okay. Now I will go through some of the important points. Now the list of important slides have been given in the WhatsApp groups. It is there in our application, so I am not discussing them. But the major chunk of your practical exam is carried by the slides. So for the slides, the slide description is important, what you write. Now don't go on by hearting the description. 1,000 times I have told you. I don't know why residents, they are after the plan. And I think there are some books also, and there are some notes which is going around, wherein all the residents, they are after, no, their description is there, okay, the slide is there, some questions are there over there. I have gone through those questions. They are very bad. Examiners never ask. The basic simple thing that they will ask you from a slide is, they will see whether your description is very honestly fitting to the slide that you have examined. Suppose you have learned a description for, suppose osteosarcoma, you have learned a description for that from somewhere, and in the exam, for example, you have seen and someone told you this is osteosarcoma. Now instead of looking at the slide, you have just written down the by-hearted description. Now there will be certain things which are not there which you have written, and there will be certain things which are very prominent which you have not written. So examiner will read that and he will know that you have just by-hearted and you have written a description. You will not get any marks over there, because no two diagnoses, they are not the same description wise. So the slides, they carry mark for the description. Description is learnt by writing, by seeing what your professors have written, by when you copy the reports in the first year, when you jot down the reports or you type down the reports, in that time you are learning how to write. Description is learned in that manner. Diagnosis carries marks. For any slide, the basic line of action is, first thing they will ask you is the classification of that particular part. Then they might go, if you answer well, they might ask you about IHC, and they might go to the differential diagnosis related to a particular slide. They might ask you certain definitions. They might ask you certain molecular features, certain molecular alterations, which is very famous. Like for Ewing sarcoma, what is famous? Okay, one important IHC marker for some of them is famous. Differential diagnosis is usually not the first line of questioning. So don't go about by hearting the DDs, because you will not be, unless and until you are not able to by yourself. See, who is able to say or read about differential diagnosis or speak about them very prominently? Those who are practicing, those who are facing difficulties in day-to-day life, they only will remember, because they are mixing it with someone else, right? So differential diagnosis is only coming in when you are diagnosing certain cases and when you are practically practicing. Now differential diagnosis becomes very important in certain cases like reactive lymphoid hyperplasia. So you have to differentiate in that condition with follicular lymphoma. Okay, so that differential diagnosis becomes very important. So as I said, you cannot by heart or do rote learning over here. Okay, now one very important aspect that the students have raised is the faster revision. Now I have already given a plan for you people that how you can revise in a very fast manner. I am saying over here also. You just take one day before the exam, you take the Robbins, or along with that you take the Pranab Day or oral for Cyto, or as well as you also take Tejinder Singh Atlas. Okay. Now what you have to do, you just have to go very fast. You go very fast. Okay. You go just through the images and read the captions very fast. Okay. You will be able to revise each and every important exam slide in around 3 to 4 hours very, very, very easily. Okay. Along with that, having said that, this is one way that I am always telling, this is the best way to revise. And I had done that, and I had, out of 32 slides that we got, 30 to 31 slides I have done right in my exams. Out of them, there were so many slides that I have never seen in my life. And this is what I have followed then, and this is what I am telling you. This is a practical way. Now, because some of you, you are not getting this point very properly, what we will be launching in the month of August, we will launch a rapid revision of 100 most important exam slides for the exams. Okay, we will start off with 100 and later on we will add more slides. So this will be a very rapid revision round that we are going to launch in August. But what you can also do is this plan that I have, always I have told you about these plans. Look at the images, look at the captions of the standard books. It is more than enough to cover all the exam slides, and you will be you will be able to answer them properly. As I told you, be honest in your description. Don't lie. Examiners hate when you lie. And one of the most important things that I would highlight is this, that only experience will work over here. No app, including ours, cannot replace the practical learning. Please, if anyone tries to tell you that no, we will show you so many slides, we will show you so many things, we will show you so many things, and everything practically also, you don't have to worry about anything. No, they are lying. Practical has to be learned in the college where you are posted. No MCQ solving is going to help you here. Pathology or any especially pathology residency cannot be solved with MCQ solving. So give up this kind of learning. MCQ based learning doesn't help, as I told you, and guidebooks are your enemy, because in guidebooks your theory is at all, it is not good. See, there is a difference between pathology exams and MBBS, because in MBBS they are just giving you few important questions here and there, that's it. So over here they are looking for ways to pass you, but in the pathology residency they are looking for ways to fail you. You are being judged not theoretically, you are being judged conceptually, and concepts cannot be made with guidebooks and MCQ solving. And whatever MCQs concept that you see in MCQs, they are just a part of the picture. They are not giving you the entire picture. So you cannot connect the dots using MCQs. So please pay a lot of attention. This is the reason majority of the students who are joining Simply Pathology, they are joining in the last 3 months, and they have just wasted the time in the different applications. Now it is not about the money. Money today is going, tomorrow you will earn money. But will that time come back that you have already lost? and after you pass, after you read our course and everything, after that you people want to join our course and want to continue, but will you be able to give that amount of time once you pass out, once you go for earning? No. So that time, that is the first year, is already lost and it is gone. It will never come back. Okay, so please be aware of these things. The second part in the practical is the grossing and autopsy. So remember, one important thing I want to highlight: the grossing and the autopsy is only constituting 40 marks out of 600. So I have seen many students, they are after autopsy, forensic toxicology, forensic. Do you know how big is autopsy? If tomorrow I have to introduce a course, and which we will, this year we are coming up with the autopsy series as well, but this is going to only burden you people. But this I am doing on demand of the residents. Currently, I have shared a PDF, a very small PDF, a 4-page PDF on autopsy of different organs, a PDF on autopsy or dissection of the heart, CNS dissection, CNS autopsy video also is there that I have shared multiple times inside of our group. So autopsy, currently the guideline that I am giving you, you can complete this within 45 minutes. Okay, and it is not like they are only asking you about autopsy. Along with autopsy, they are asking you about the normal grossing of the uterus, grossing of the stomach, grossing of the breast, grossing of the colon. Okay, so all these are very commonly kept exam specimens. Okay, grossing specimen, and the videos are also being covered. Every video has been covered with regards to the grossing. So direct questions are being asked from there. So practice and regular work in the grossing room counts. Your manners and your etiquettes and the way you are holding the specimen, the way you are describing them, they also matter. It shows that you have worked over there. Okay, so even though we make 1000 videos on autopsies and everything, till you have not experienced and done it yourself in the college, it doesn't matter. Okay, then I have already discussed about the clinical pathology, biochemistry, blood banking. Now remember, these are all MBBS based. So any clinical pathology based book you can read and you can go, like for urine ketone body, glucose, protein, for urea. Okay, biochemistry, the same biochemistry, the same questions that were asked in the exams in MBBS, the same questions are asked over here. Blood banking, again, blood grouping is there, cross matching is there, Coombs test is there. So all these things you must have learned while you were teaching the undergraduates or the physiotherapy people or the dental people. Okay, so blood banking, all these important tests I have discussed in details. So I'm not going into the details of this, and everyone have, this portion is very easy and very scoring. And even, okay, 1 month before the exam or after your theory exam, okay, 1 week before your practical examination, they will show you each and everything. So urine routine examination, all lecture is also there in the application. Peripheral blood smear, you should be able to make the peripheral blood smear. You should be able to write, and you should see how a reporting of urine is done, how reporting of PBS is done, how reporting of fluids are carried out, how reporting of malarial parasite is carried out. Okay, then there are problem cards. Okay, some sample problem cards I have already given in the group, so I'm not repeating all these things again over here because that has been done. Okay, the sources have been given, and this is a very scoring part in the practical. Tissue processing part, a part which is neglected by you people. You should know how to do staining of a standard H&E stain and one special stain, especially PAS. You should know the cytology stains like MGG, PAP. You should know in the tissue processing how to use the microtome, how to take the sections. Okay, how to take everything, how to take the section and how to put it. Okay, entire tissue processing process you should be able to explain. Now these are all the practical aspects, okay, which is expected out of a pathologist that they should know. This is a must. Tissue processing part is a must. I think this is also carrying approximately 40 marks. Then in the end, you are having the grand viva, you are having the thesis, you are having the different charts. Now the different charts is theoretical. I have discussed about them, which are the charts which are important. I am not discussing over here. What is important from the thesis point of view, of late I have seen majority of you people, you are getting your thesis done by a third person. You are paying money, you are getting it done. Now the problem over here is that you have to be able to make the examiner understand that what is your study in brief. as well as what were your findings. So the problem over here is because you have made up each and everything and you have not even worked on a few cases. So what is happening that you are not able to answer anything over there, and this gives a very, very bad impression to the examiner. So do not ignore, even if you are doing the thesis from an outside person, from a third party, at least read your thesis, at least understand the work that you are doing. Okay. Now grand viva again is very, very important. What is important in the grand viva? That even if your practicals they don't go well, suppose your grand viva, or suppose in your practicals you have not answered very well, okay, either because of nervousness or because of lack of sleep. So if you were a good and hard-working resident for the past 3 years, so in that case, the HOD, the professors, the teachers, assistant professors, they will tell the outside examiner that no, he is a good student. I think today because of exam, it happened. So there is some consideration or some factor like this is there in the practical, but in theory, there is no such consideration. Okay. So in the grand viva, your behavior is very important. Please do not try to act smart. If you know a lot of things, don't try to show off your knowledge. Remember, whatever, even if the examiner is wrong and you are right, always remember you have to agree that the examiner is always right. Do not cross question the examiner, because you will hurt the ego of the examiner. If you don't know anything, say I don't know. Don't waste the time. The examiner can ask you other questions. You should be neat and tidy and you should be confident. Always remember, if the examiner asks you where you have read, from where you are reading, use the name of standard textbook or name of a standard journal. Okay. Usually in the grand viva, basics and basic definitions they are asking, and grand viva is holding a good amount of 200 marks. Approximately 1/3 of the marks is there in the grand viva. So it carries a lot of marks. Out of the 600 marks, 1/3 marks is there in the grand viva and the thesis together. Okay. So with this we have completed, okay, the art of acing the theory and the practical exam. I know this lecture has gone a bit further, but I had to take and I had to address these things with you people so that you do not make these mistakes and so that you are successful in your exams. Okay. Remember this thing very importantly. Okay. Now, very important thing is dealing with the theory. What is not covered, which has been covered separately, all the topics I have already covered, so I am not discussing it again. What should be your timetable for reading? How you should read in morning, which topic, heavy subject, light subject, in details we have discussed that. So we are not discussing this again. Details of the exam components, okay, in short we have discussed here, but details have been there in the other video. Now, all the extra materials which are given in the Instagram and WhatsApp groups, also all the exam materials that has been given, we are not discussing it over here. It is already discussed in the revision plan video, and other details which are there in the exam groups for all the enrolled residents I have given there. Okay, so those things are not discussed today. So with this, I would like to rest my case and thank you for watching this particular video, and I hope you have learned a great deal from this video.